The technical gold standard test was something called a jejunal aspirate and culture. Basically, during an endoscopy, they'd stick a tube down into the jejunum, the middle part of the small intestine, suck out some fluid, and then try to grow and count the bacteria in a lab.
Sounds definitive, but I remember the notes mentioning it's not really done much anymore. Pretty invasive, right? And maybe not always accurate.
Exactly. It's invasive, it's expensive, there's a risk of contamination during the procedure, which can skew the results. So yeah, it's rarely used in standard clinical practice these days.
So what is the standard approach then? The non-invasive one?
The workhorse is breath testing. It's much more practical. The idea is pretty neat. You drink a sugar solution, usually lactulose or glucose. If you have excessive bacteria in your small intestine, they'll ferment that sugar way earlier than they should. That fermentation produces gases, specifically hydrogen and methane. These gases get absorbed into your bloodstream, travel to your lungs, and you breathe them out. So we collect breath samples over, say, 2 or 3 hours and measure the levels of these gases. A significant rise early on suggests Sibo.
And the type of gas is important, like we touched on, hydrogen versus methane.
Yes, very important. Generally, high hydrogen H production is linked more often with diarrhea-predominant symptoms, whereas high methane CH production is strongly associated with constipation and that IMO picture we discussed. So the test can give clues about the type of overgrowth.
Okay, that makes sense. But their research also mentioned some debate about how reliable these breath tests are, especially maybe the lactulose one. What's the general feeling on that now?
That's a fair point, and it's true. There's ongoing discussion. Glucose is thought to be more specific for Sibo in the upper part of the small intestine because it gets absorbed quickly. It's less likely to reach the colon and cause a false positive from colonic bacteria fermenting it. Lactulose, on the other hand, isn't absorbed, so it travels the whole length of the small intestine. This means it can detect overgrowth further down, but yes, if someone has fast transit, it might reach the colon within the testing window, potentially giving a false positive.
So a bit of interpretation needed.
Definitely. Neither test is perfect, but there are best non-invasive tools right now. The key is interpreting the results alongside the person's specific symptoms and history. They provide strong indications.
Got it. And are there other tests that help build the picture?
Yeah, often other tests are used in a supportive role. Blood tests are really useful for checking those nutritional deficiencies, B12, iron, ferritin, fat-soluble vitamins, checking for anemia. Stool tests can help rule out other things like infections, parasites, or assess markers of digestion and inflammation. And occasionally, imaging like a CT scan or MRI might be ordered if there's suspicion of an underlying structural issue like a stricture or adhesions.